Senior System Director for Infection Prevention at Hartford Healthcare. Morning, and as always, I appreciate the opportunity to share our data and information with you guys. And we'll start with some data from the COVID-19 disease process. So currently, positives within the system, there's 317 positive patients within the system. There's 189 PUIs, and it breaks down by Behavioral Health Network with 9 positives. PUIs are 21 for Behavioral Health Network. For Charlotte Hungerford, we have 12 positives and 15 PUIs. For Hartford Hospital, we have 144 positive and 93 PUIs. Midstate Medical with 16 positives and 4 PUIs. St. Vincent Medical Center with 76 positives and 22 PUIs. HOCC with 53 positives and 28 PUIs. And Wyndham Hospital with 4 positives and 6 PUIs. There's a number that I actually brought with me as well that I want to report out, and it's 959, and that number represents the amount of patients that's recovered through the system so far. Pretty significant number. When we started this process, it was unclear of the mortality rate, it was unclear of the clinical management of these patients, and I believe the system has done an excellent job in ensuring that so far over 959 patients that's been diagnosed with this disease process are home. The other number is the amount of testing that we've done so far. I think we're at over 19,000 tests. That's pretty significant. Again, this is one of the commitment from Hartford Healthcare through this whole process is to ensure that the appropriate testing is available and in appropriate quantity that it will impact our community as much as possible. I think one of our biggest unknowns in this entire process is how many people have the disease within the community, and obviously the impact that that does have. And I think based on the commitments of our institution, this is something that we're much closer to having a better idea of by, I think, 2,500 tests committed to the system or to the community daily. So that's a big deal. The other thing is, or what's called our positive conversion rate, and why this is important. It gives us an idea of what we should expect based on our PUI numbers. So as I reported before, there's 189 PUIs right now. So these are patients that are under investigation. So the positive conversion rate of, I think, about 21%, it shows what we expect the upcoming impact will be, and I think that's a big deal. The last thing, and probably should be the first thing that we talk about as we celebrate Nurses Week, I think no one, and probably within healthcare, can have a public announcement without recognizing the exceptional contribution that every single nurse within healthcare over the last few weeks have done, not just for Hartford Healthcare, not just for Connecticut, but definitely for healthcare in general, nationally, and exceptionally, definitely globally as well. So with that, I'm going to introduce Dr. Pavlos. And he will talk more about the antibody study, and we'll take questions after that. Thank you so much.
Good morning. My name is Pavlos Papasavas, and I'm the Director of Research for the Department of Surgery and the principal investigator of a new study that we're about to launch in Hartford Healthcare. The purpose of the study is to measure the prevalence of antibody presence among our healthcare workers in our system. And this is a very hot topic right now about the antibodies. Everybody reads about antibodies and what they mean. And because it's a very new disease and we're still learning every day about this disease, we don't have all the answers about the antibodies. And this is why we're conducting this as a research project. Basically, it involves having a blood draw and measuring or detecting whether antibodies have formed in the person's body. We are specifically looking at IgG antibodies, immunoglobulin G type of antibodies. And this is basically the footprint that the virus leaves when a person is infected, symptomatic or non-symptomatic, with the virus. And we will get a lot of information about how many of our employees in our healthcare system have these antibodies based on the type of job they have and where they work and whether they had contact with COVID or not. This is going to be very informative. It will not tell us whether the person has immunity against the virus, and this is a very important point that I would like to make. Having the antibodies does not mean that you can stop using the PPE, the personal protection equipment, or you can stop using social distancing. You still have to follow the same measures. Hopefully, with more studies in the future, we'll be able to tell whether the presence of the antibodies confer immunity to the person. So more to follow. I will take some questions later on, but I would like to introduce our next speaker, who is Melissa Daisy from the Institute of Living, who is going to talk to us about what services are available for children and adolescents to cope with this pandemic. Thank you.
Good morning. Again, my name is Melissa Daisy, and I am the Program Manager at the Child and Adolescent Outpatient Services within the Institute of Living. I'm so happy to be here today to share a little bit about our vulnerable population. Since the COVID crisis occurred, we have moved all of our services through telehealth. So we are currently offering individual, family, group therapy, and family therapy. We've also increased our parent support groups to really support our parents who are struggling during this time as well. So some of the behaviors we're seeing, or some of the concerns we've been seeing since the COVID-19 crisis has occurred, is we've seen an increase in anxiety and depressive symptoms. Now this can include pervasive and sad mood, hopelessness, increase in suicidal thoughts, sleep disruption, so sleeping all day or not sleeping at all, excessive worry and concern. We've also seen an increase in family conflict. So we are here to help, we are here to support. Even though we have to be physically distant, we can stay socially connected. So our availability is open. If you'd like to make a referral to our services, please contact the Assessment Center at 860-545-7200, and help is available. Thank you, and now I'm going to open it up to some questions.
Hi, this is from Fox 61. I wanted to reach out and ask what, if any, use that you have had from Remdesivir, that new prototype drug that's out there, and whether or not that's actually being used at Hartford Hospital.
I'm tentatively going to say...
John, hang on one second. We're going to get Keith for you.
Yep.
Talk about this. Governor Lamont, in a briefing, said that he waived the need for a doctor-provider order for the antibody test. When and where can we go to have the test?
So the study that we are about to launch involves only healthcare workers in Hartford Healthcare and not the public. I know that several laboratories, including Quest, that is a partner of our system, have this test available. So a person can obtain a serology test via a laboratory. I was not aware of this directive by the governor, whether there is no need to get a physician's order for the test, but the test is available. Thank you.
Is this, sorry.
Hi, it's Bridget, the Republican American. A question for Melissa. You said an awful lot there in a very short amount of time. Could you go back to the children who are perhaps suffering, and what is perhaps a percentage of the population that you're seeing, or how many are you seeing, and are they going back to their families, or are they being treated inpatient?
So that's a very good question. We're seeing both.
Within 3 weeks,
In the beginning of the COVID crisis, we saw more youth coming from our inpatient units. I think because families were concerned about bringing their youth to the emergency room. And that's one of the reasons why I wanted to be here today. I wanted to let our families know that a child does not have to go to the emergency room unless they are being unsafe because they're suicidal or have some very concerning behaviors. We are available to take referrals from the community. So we would like to be able to open our doors, our virtual doors, and offer support to the public, to the community. And the other piece is schools aren't physically seeing kids. Our PCPs aren't physically seeing kids. So we wanted to make sure that our community knew that we were open and we're available for support.
And are these generally fairly treatable situations with anxiety and no deep-rooted depression issues?
We're seeing both. As we know, our children and adolescents are vulnerable that have pre-existing mental health issues, but we're also seeing new youth emerge from the community that are struggling with this pandemic, and they are treatable. We have been seeing very high success rates. We are able to offer the group therapy via telehealth, and again, the ability to connect even via telehealth with other peers struggling has been so positive.
Okay, one more follow-up question. What are they reacting to? Is it the social media, their parents, the situation? What are they reacting to?
Can I say all the above? There is so much information out there, and really for our younger kiddos, we recommend that they're limited. Their media time is limited and supervised. We really encourage families to get out with their children in terms of what else can they discuss besides the pandemic. We're also seeing family conflict because youth are in the home all the time. Families, youth, they don't have a separation. So there's a lot more family conflict because there's a lot more together time. So how can we create that into family fun time, whether it's a spa day or themed dinners or family game night? You know, there's lots of different ideas we can do.
Thank you.
Thank you.
Sorry, John, we'll get to your question. We have Keith back now. Sorry about that.
All right, no problem.
Sorry, guys, there's multiple things going on. What was the question?
I wanted to ask about Remdesivir. I'm probably mispronouncing that, but the drug that's being given some approval and testing right now. I wanted to see whether or not that's something that you're looking at or using, and if you're using it, is it in what kind of supply do you have of that?
Okay, so we'll talk about the actual drug itself, so Remdesivir. So the drug has had a very promising study, one of the most promising study from a pharmaceutical perspective in relating to COVID-19 we've seen yet, right? So it was a very good actual study that was performed with exceptional result that shows really good efficacy and great outcomes, and very safe as well, and with some degree, high degree of safety as well. In regards to supply, I think supply for Remdesivir is very challenging. The manufacturer of the actual drug has committed, I think, 140,000 of that drug for use to fight COVID-19. So there's a process of application that all hospitals are going through right now, and we will have some more awareness very soon as to where we are, where supply is concerned. It's not a drug that we're using within the healthcare system at Hartford at this point, and it's not a drug that I assume no one else within the state is using at this point. But it's anything that's promising, our primary goal is to ensure that the best therapy is available for all patients that come through Hartford Healthcare System and for all patients and community members within Connecticut. So it's a drug. It's a very promising drug. We're looking at it. Supply is challenging, obviously, but we're working with the federal government and we're working with all other agencies to try to ensure that we do get the drug in place.
Thank you, and I just want to follow up on that, and I'm not even sure this is a question from a viewer, and sometimes they don't know what they're talking about. But the question was: are there any statistics on the number of those who got or died from COVID-19 who had or had not received a normal virus shot? And I'm only thinking maybe a flu virus shot. I don't know. Is that something you've ever considered or looked at?
It's something we consider looking at. Is that data that's It's not a specific data frame we've looked at and concluded on yet, but we're looking at basically everything. What I can say, though, if we look at that, so a huge comorbidity for the disease process is someone with respiratory illness. So someone with chronic lung disease, for example, someone with asthma is a huge, complicated event that decreases the probability of someone actually coming through this disease process. So I would say that, for example, the influenza virus, in order to prevent yourself from getting influenza virus, the influenza vaccine has been proven very effective. And the complication with that is not having the influenza vaccine on board puts you at risk for the influenza virus itself, which in turn impacts your complication and impacts your probability to recover. So.
Okay, well, that was a very thoughtful answer to a not too tough question. I appreciate that.
Anything else?
Yeah, the only question I have is, you've never reached capacity in terms of beds, is that correct? So the actual disassembling of some of these standby facilities, like at the convention center, that's not going to be an issue, is that correct?
So I just want to, the disassembling of the convention center is a tentative approach at this point. So the plans are still set up just in case we need to move it forward. It will be very expeditious. So although we're taking it down, structurally a lot of it is coming down, but it will have the capability to go back up within a matter of less than days. So with that being said, Hartford Healthcare itself, we've been able to, based on all our beds within our system, to utilize them very efficiently. So in some cases, we've actually moved patients from one hospital to the next to facilitate the process. But yes, I agree with what you just said in the fact that we are taken down, but in that same conversation, we have to maintain the fact that there's still significant epidemiologic evidence out there that we should be very cautious.
All right, I appreciate the question, the answer. Thank you so much.
Absolutely. Anything else? No? All right, guys. Thank you so much. Have a